So, the healthcare delivery is changing a lot, and we see a shift, especially in the US, towards retail health. Where do you see the biggest changes that are actually tangible already?
So what's really interesting is, as we've lived through 3 years of the pandemic, we're now entering the fourth year of the pandemic. Just think about that. There's so many lessons learned that we've really built the next evolution of where health and care is going. In our organization, we built essentially the largest hospital at home program in the country, and the next leap forward is really in the home. There's a McKinsey study that says $265 billion of care dollars are actually shifting from the traditional bricks and mortar facilities to the home in just the next couple of years by 2025. Last I checked, 2025 is just around the corner, right? So that, I believe, is the next leap forward. And we just announced a huge partnership between Atrium Health, which is part of Advocate Health, and Best Buy Health. So it's really interesting when you think about going to a Best Buy store, a retail store, where you can go in, buy a big flat screen TV, but you can also go in and, it's really the Switzerland of medical devices, right? So you have Apple devices, you have Google devices, you've got all sorts of devices, and you have the Geek Squad that goes into your homes to help fix your Wi-Fi and your TV. But now, working with us, right, what we're building together is really co-innovating and saying, all right, the next leap forward is the coming together of technology and empathy. Right? It is choosing to meet our consumers, our patients, our communities where they choose to meet us. And it's helping them, right? So it's not just throwing digital and data and technology after a problem, but it's really helping them and meeting them in the middle. So we have paramedics, we have social workers, we have nurses, we have physicians, and then we have data and remote patient monitoring. But entering the patient's home, really improving the experience, bringing costs down and improving the quality.
How much did that require you to change the way you provide healthcare? Did you, for example, did you hire new people basically to do the home care if there's a need for the intervention physically at someone's home, or did you just change the work processes so like people that used to work on wards are now partially working in the home setting as well?
So this is all about pivoting, right? This is all about pivoting the resources and the capabilities as well as the innovations that we have and really going after something new. So this is us taking our workforce around the paramedics, around the social workers, and growing that program with the critical needs that we saw that the pandemic played out, right? So when the pandemic played out, we had tons of COVID positive and COVID presumptive patients that were flooding our hospitals and really putting our ICUs to the maximal capacity. And capacity continues to be a big issue. In Charlotte, Charlotte is one of the fastest growing cities in North America. Capacity is a big issue. So what we said was, let's decompress these hospitals, but also let's improve the experience and bring the costs of care down overall while increasing the quality by creating essentially virtual hospital floors in patients' homes. So we're able to create this infrastructure by pivoting the capabilities that we have. We have, years worth of experience in building our virtual care capabilities and services. We took the paramedics, we took the social workers, but we also took our virtual health platform and really built this out to what it is today. And with the partnership with Best Buy Health, I think the world's our oyster.
I have one more question. So there's an obvious shift to virtual care because of the sustainability issues with healthcare, and it's I guess useful to differentiate between the virtual care that's just remote monitoring of chronic patients to virtual wards where you basically have the person at home instead of a hospital and use all the monitoring that you would in the hospital to monitor that patient. And the NHS is currently investing 450 million pounds in the next 2 years to expand the virtual wards and to decrease the burden on the hospitals. But like a lot of physicians are very skeptical about that because it's not like they can discharge patients faster at the moment because they say that they're not holding on to patients anyway already, so that's not really a problem that virtual wards are addressing. And at the same time, if you introduce virtual wards, there's different challenges that arise, So, for example, if a nurse comes into someone's home, she needs to be aware of what kind of dangers she can encounter there, and she might not have the help of colleagues that you can have on the ward. So based on like your long-term experiences, what do you see as the biggest challenges in the broader virtual health provision?
So it sounds to me like the NHS needs to be talking to us because we've got some experiences around this. And clearly, we've found out all of those elements, right? Those opportunities, not just challenges, but opportunities of when a nurse or a paramedic or a social worker or a combination thereof, a care team goes into a patient's home, what are the things that they need to be looking out for? Everything from fall risks to security elements to, Wi-Fi, is it working or not, to various other elements as well. So we've figured it out. But I think this is an opportunity to truly pivot. This is an opportunity for us to really say, all right, can we actually decrease the length of stay? And we're showing that we can. Can we actually take patients who would otherwise have prolonged stays in the hospitals? These are post-op patients who are maybe recovering from a knee arthroscopy or a hip arthroscopy, or congestive heart failure patients, or patients with pneumonia and congestive COPD, right? Can we actually discharge them earlier so that we can then treat them in the comfort of their home? And I think we can. So we've proven that we can. We're now bringing in technology, but also these human capabilities to really meet them where they choose to meet us and shift the way that we're providing care once and for all.
And really, one last question. Do you perhaps know how the virtual care provision is impacting cost? You mentioned that there's a decreased burden on the capacity that the hospital needs to have, but do patients feel the financial burden of virtual care? What's the difference there?
Yeah, absolutely. So yes is the answer. There is actually a pretty good shift downwards in the costs overall. We're tracking to all of this. We would not be scaling the program had it not been with those positive momentum that we've actually seen through the pandemic. And then, in addition to the costs, there actually is an increase in the quality as well as a 10 point increase in patient experience, which is amazing, right? And patients across the board have been telling us that, oh my goodness, for me to be able to recover in the comfort of my home, for us to look at the care team, not just as the physicians and the nurses, but also the paramedics and the social workers and the circle of trust that the patients have in their own home. It could be their moms, it could be their grandkids, it could be others, and have that embedded in the care fabric of what we're providing. I think that has dramatic and direct consequences to how cost decreases and experience increases, as well as the quality goes up through the roof as well.